Have you ever heard the term slip disc, or maybe thought that you have a slip disc? Some of the symptoms that go along with this particular condition are neck pain, back pain. You may also have pain that runs down an arm or possibly down into one of your legs. You can have numbness and tingling in an arm or a leg as well. Well, let's look at a little bit of the anatomy and try to figure out what exactly is a slip disc. Our spine consists of 24 movable vertebrae. There is an actual cushion or a little pad in between each one of these vertebrae. That is an intervertebral disc, or what we call a disc. If we can get a visual picture of what that disc actually looks like, it is very much like a jelly donut, if you will. There's a fluid center to that jelly donut or the disc. There's circular fibrous cartilage that surrounds that jelly center. So what actually happens in this slip disc is that jelly starts to move from the center of the disc towards the edge. This happens when some of these circular rings tear through wear and tear and injury that occur in our back or neck. So that jelly will start to slip towards the edge and actually bulge out. If it occurs significantly enough and the jelly actually squirts out of the disc, that's called a herniated disc. When that happens, the disc and the jelly will actually press right on one of the nerves that exits in between the two vertebrae, and hence the pain can go down into an arm or a leg, or you can have numbness or tingling. But does the disc actually slip out of place? No, it does not. That's kind of a layman's term. All of the same thing, a bulging disc, a herniating disc, are all degrees of the same condition. So what can we do about this? What can be done for this particular problem? The first thing to do is determine, why are you hurting? What exactly is causing your pain? We will do a thorough physical examination, history. We'll probably send you for some x-rays and or an MRI to actually look at that disc. So once it's determined that you have an intervertebral disc problem, a bulge or possibly a herniation, we need to set up a treatment plan. Believe it or not, most of these conditions are treated very successfully conservatively. That means without surgery. Some indeed do need surgery and are actually rather emergency situations where the extent of that bulge or herniation is too great for conservative care. But there's a variety of different types of conservative care that include chiropractic care, spinal injections, physical therapy, exercise. The American Medical Association has recommended that patients undergo conservative treatment prior to surgery. They've actually included chiropractic in those recommendations for herniated disc and bulging disc treatment prior to surgery. Injections are also a possibility. Chiropractic care and studies have been proven to be just as effective as injections, but much safer. Injections, as you know, is a medication you are injecting into a joint. It does have side effects. There's also a study that indicates injections, spinal injections, increase the risk of spinal fractures. Surgeries also in that situation. Surgeries, about 70% of the patients following surgery still have some degree of back pain. So the best recommendation is chiropractic care. We here at San Carlos Chiropractic at Fort Myers Chiropractic Clinic, we use a form of spinal decompression, which creates a negative pressure inside the disc. Our treatment actually helps to pull this apart a little bit, create some negative pressure inside the disc, and actually pull that bulge or herniation back in. We couple that with specific exercises and physical therapy modalities. Is a very, very effective form of conservative treatment. So if you're suffering with what you think may be a slip disc, please call my office, 239-267-3133 at San Carlos Chiropractic. Let's set up an appointment where I can sit down with you, discuss your problem, and at least do that first step, which is a thorough spinal examination, determine what's causing your pain, set up a treatment plan to get you out of pain as quickly as possible. Thank you.